Now, the second thing we have to do is to do something about health care. And this is a very serious policy difference in this campaign. Everybody who doesn't have health care contributes to the cost of the people who do. You have to decide if you agree with this. Every other country knows that you can't control health care costs unless you cover absolutely everybody. And of the three people left, Senator McCain covers the fewest, Senator Obama covers most, Hillary's plan is the only one that covers everybody, according to all the independent studies. That's why the American Nurses Association departed from precedent and endorsed her in the primary, because they said this is the biggest problem America's facing, and she's got the only plan that will solve it. And why Elizabeth Edwards, who, to be fair, has not endorsed a candidate, but said Hillary had a better health care plan. You just have to decide whether you think this is important. But I think I can explain to you in simple terms why you can't control costs unless you cover everybody. Number one, every time somebody pays for health care, they're contributing to $50 billion the insurance companies pay every year, figuring out how not to insure people. Think of it as your non-insurance premium. I mean, really, I'm sorry, sir, I'd like to give you health insurance, but you have a pre-existing condition. I'm sorry, ma'am, you do have a health insurance policy, it just doesn't cover what you need right now. I'm sorry, you have a policy, it does cover what you need, but I just reviewed your application and you forgot to fill out the third line, so I'm revoking your policy. $50 billion a year you spend on this. You wouldn't spend a penny of it if we were all covered, because it would be illegal. Second problem, bigger. 30 cents of every healthcare dollar, 30 cents, is wasted on paperwork. Is there a business in Elon that could keep its doors open, blowing 30% of its revenues off the top? No. Why do we do it? Hundreds of companies writing thousands of policies, they all cover different things. It's a nightmare. If we had her plan, and here it is, you wouldn't do that. Keep in mind, Medicare's administrative cost is 3 cents on the dollar. McKinsey and Company did a study last year that said Americans pay $200 billion more in paperwork costs for health care than you would pay if you had any other country's system. $200 billion. That's twice what you need to insure people. So here's her alternative. If you like what you've got, you can keep it. If you don't like it, you don't have it, or you can't afford it, then you can buy into the same plan that insures federal employees and members of Congress and our families. If it's good enough for our family, it should be available to your family. And that will make a huge difference. If you're young and single and on your own, all you got to do is have enough to protect you against a car wreck or an unforeseen illness. But if you have little kids and you need dental health coverage, you can get it. There is complete and good parity for mental health coverage. This is a good policy, and it's less expensive than you could get anything like it in another market. How can you pay for it and be made affordable? Because once it's illegal to spend $50 billion, you save that money off the top. You save a ton of the $200 billion in paperwork, because we'll all be in big pools. You take the savings and give it to lower income people, to small businesses, to family farmers trying to help their employees, to make sure nobody can pay more than a low fixed percentage of their income in health care, and everybody's covered. You just have to decide if this is important to you. But if you're tired of making excuses and you want to make progress, you should vote for Hillary for president and get a better health care plan. It will change the future of this country and enable us to restore economic growth. You cannot, I will say this again, I don't care who you elect president, if we keep doubling health care costs every 7 years, you can't bring the economy back. There won't be enough money to invest in education. People won't have enough money to consume. This is the first time in my lifetime that I've ever seen the labor unions, but bless their soul, they have always been for universal health coverage on moral grounds. If our family's got it, everybody ought to have it. But they're now allied with some of the biggest non-union companies in the country. The president of Walmart stood on the stage in Washington, D.C. with a bunch of labor leaders calling for universal health care. You know why? Because he knows if your health care costs keep doubling every 7 years, you won't have any money to spend at Walmart or any place else. So this is a big issue for the young people of this country.